I'm going to focus my questions on the number one issue on the minds of the people of Hawaii, and that is the closure of the Red Hill bulk fuel storage facility. Mr. Secretary, thank you for including Red Hill in your testimony before this committee. Last Friday, the Hawaii Department of Health issued an emergency order regarding the closure of Red Hill. It sets specific timelines that the Navy must comply with for the safe and expeditious defueling and closure of Red Hill. On Monday of this week, the Navy waived its right to contest the state's order, effectively paving the way for Red Hill's permanent shutdown. It requires the Navy to provide the state with an independent contractor's assessment on facilities operations by May 15th, a plan and implementation schedule to defuel by June 30th, and a plan for closure of the facility by November 1st. Secretary Del Toro, in the interest of time, I have three yes or no questions for you. The first is, will the Navy be able to meet these three Department of Health deadlines this Sunday for the NAVSUP FLC Norfolk Contract Assessment Report, June 30th for the defueling schedule, and 1 November for the closure plan?
So, Congressman, that's to be determined. As you know, that there's language in the executive order that actually allows us to actually have further discussions on the exact timeliness of the dates.
Will the Navy be able to meet the SecDef's March 7th memo, which requires both yourself and the director of the DLA to provide a defueling plan of action to the SecDef by May 31st?
I can't speak for the director of the DLA, but the Navy will meet its requirement to the Secretary of Defense.
Excellent. Finally, there are multiple ongoing investigations. The commander of PAC Fleet ordered a command investigation on November 29th, 9 days after the catastrophic leak. The PAC Fleet commander received that report, Admiral Paparo, on January 14th and turned it over to the Pentagon. In mid-March, the Pentagon ordered a supplemental investigation because the original report was insufficient. When will the congressional delegation, the state of Hawaii, and the people of Hawaii, as well as our 100,000 military service members and their dependents that are on the Navy's water system, get to see and review the results, redacted or unredacted, of this command investigation? Could you give me a timeline? Can you give the people of Hawaii a date?
So, Congressman, that investigation has been completed. It is under review by the leadership of the Department of Defense, and it will be released in the next several weeks.
Several weeks?
Yes, sir.
Okay, just want to reemphasize, it's been 6 months since the November 20th fuel leak. The full extent of this public health crisis and the environmental damage is still not yet known. As recently as April 1st, a little over a month and a half ago, there was another release of approximately 30 gallons of fuel and water mixture from a maintenance line connected to Tank 15 at Red Hill. So this is very, very important for the delegation and for the people of Hawaii, and I appreciate your promptness in this issue. Secretary Del Toro, of the approximately 93,000 people in the Navy's water distribution system on Oahu, it is still not clear how many people have been affected by the May and November 2021 fuel spills. Assistant Secretary Meredith Berger's memo to you on March 29th, she mentioned that the Agency for Toxic Substances and Disease Registry conducted an expanded public health study that included all non-federal civilians and DoD personnel served by the Navy's water system in their homes, their workplaces, their schools, and their child care centers. The preliminary analysis of this survey determined that 86% of the surveyed individuals exhibited symptoms consistent with acute petroleum exposure. Can you elaborate at all on this study and share any of this data with the public?
Sir, that was a survey that was conducted. We obviously, in our interest to protect our sailors, our Marines, their families, and all other individuals in the Department of Defense, also in the state of Hawaii, have ensured that we've had 2 surveys now, one conducted by the CDC, another one conducted by the Navy, to try to capture all the individuals that have been impacted by this. And that survey result of 86% is reflective of the answers that were provided by individuals.
Okay, last question. The Navy's compromised water system is also currently contributing to a water shortage on the island of Oahu. The Red Hill well and the nearby Aiea Halava well remain offline, disconnected from the Navy's water distribution system. Honolulu Board of Water Supply anticipates a water shortage this upcoming summer. It's calling for a 10% water reduction for urban Honolulu. What is the status of the Red Hill and Aiea Halava wells? When can we get that back online, and we can take that for the record.
No,
run
yes,
it.
sir, and I'd like to comment real quickly. As you know, sir, we've been testing the Red Hill. All indications right now are that it's safe. But that's a determination that has to be made by the Department of Health at Hawaii, and we continue to work very closely with the Department of Health and other officials on Hawaii to come to that proper conclusion at the right moment in time.
Thank you so much.